Does elbow pain have you feeling down for the count? Is everyday activity turning into a struggle? Don't reach for pain relievers just yet. Here at Herbs and Harmony, we're serving up natural remedies and gentle stretches to tackle tennis elbow and get you back on track. Say goodbye to elbow woes and embrace pain-free movement. Subscribe to Herbs and Harmony and unlock a treasure trove of natural remedies, effective exercises, and expert tips to heal your tennis elbow fast. Together, let's create a symphony of health and well-being. Tennis elbow, medically known as lateral epicondylitis, is a common condition characterized by pain and inflammation on the outer part of the elbow. This overuse injury often arises from repetitive activities, causing strain on the forearm muscles and tendons. Types. There are two main types of tennis elbow: lateral epicondylitis or tennis elbow. This is the more common type, characterized by pain on the outer part of the elbow. It usually occurs due to overuse of the forearm extensor muscles. Medial epicondylitis or golfer's elbow. Less common, and tennis elbow. Golfer's elbow involves pain on the inner side of the elbow. It is caused by overuse of the forearm flexor muscles. Both types are overuse injuries and can affect anyone, not just tennis or golf players. Causes. The main causes are repetitive strain. Engaging in repetitive activities such as gripping, twisting, or lifting can strain the forearm muscles and lead to micro tears in the tendons around the elbow. Incorrect technique. Improper technique during sports like tennis or inadequate form during other activities can contribute to the development of tennis elbow. Overuse of forearm muscles. Continuous use of the forearm muscles without adequate rest can result in overuse, leading to inflammation and pain. Sign and symptoms. The signs and symptoms of tennis elbow typically include pain. Persistent pain on the outer part of the elbow, especially when gripping or lifting objects. Weak grip. Difficulty in gripping objects or weakness in the affected arm. Stiffness. There is stiffness in the elbow joint, particularly in the morning or after periods of inactivity. Tenderness. There is tenderness on the outer elbow, often concentrated around the bony bump. Radiating pain. Pain that may radiate down the forearm and sometimes into the wrist. Worsening of symptoms. Symptoms may worsen with activities involving wrist extension or repetitive forearm movements. Treatment. Rest and activity modification. Give the affected arm time to rest, avoiding activities that worsen symptoms. Modify techniques or grips during activities to reduce strain. Ice therapy. Applying ice to the affected area can help reduce inflammation. Use an ice pack for 15 to 20 minutes several times a day. Pain medications. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, may be recommended to manage pain and reduce inflammation. Bracing or splinting. Wearing a brace or splint can provide support and limit movement, aiding in healing. Physical therapy. Specific exercises can strengthen the forearm muscles and improve flexibility. Corticosteroid injections. In some cases, a healthcare professional may recommend corticosteroid injections to reduce inflammation. Shock wave therapy. This non-invasive treatment uses shock waves to stimulate healing in the affected area. PRP or platelet-rich plasma therapy. This involves injecting concentrated platelets from your blood into the affected area to promote healing. That's a wrap on tennis elbow. Remember, gentle stretches and a little TLC can make a big difference. Hit that subscribe button for more natural healing tips and let us know if you've conquered your elbow pain. Thanks for watching.